roll with us, that would be great. Thanks, Ellie.
Fantastic. Thank you very much. So Sam, thank you very much for inviting CYP Mental Health RISE service to come and talk with everybody today. Hopefully you'll find the webinar really helpful. Joined with colleagues from both RISE and in particular, as the screen says, support around working around the child and the young person. So hopefully what you'll find for the first part of our time with you is an update and some information regarding the child and young person's mental health offer for children and young people within Warwickshire, and then we'll be able to broaden that out with the specific needs and questions in the answer and questions bit afterwards. So Ellie, next slide, please. Thank you. So thought it would just be very helpful to just start off with this slide, and this is the main core and the vision of RISE's Child and Young Person Mental Health offer. When we began the RISE service in 2017, one of the key things that we wanted to do was recognise that every child gets support when they need it. And what we heard at the time from Young Minds, who supported us with the relaunch of a RISE offer, was that they felt that they were having to do a number of the navigating and that a number of doors were placed in their way. So we aspired with the young people from Young Minds to have a vision of no door is the wrong door. And as a result of the RISE model, we turned it on its head, and traditionally CAMS services, as they were known then, were very much developed and commissioned on a tiered system. So you would have a triangle of tiers where you actually had your universal and your tier 2 at the bottom, and they were your biggest parts of your triangle. And then as you got further up in terms of tier 3 and tier 4, it felt as if there were each step was a number of barriers and boundaries. So what we wanted to do was make it a very inclusive offer. And this still is very much how we work today. So although this was our starting model in 2017, we still have a blend of our RISE offer. So the navigation hub, which was born in 2017, is very much still there and supports that whole wraparound of doing what it says on the tin, helping to navigate referrals into the RISE service to the right place, to the right support. And if it's not needed, then being able to support and signpost. We then have a community offer, and we'll talk a little bit more about how this has been completely invested in over the last couple of years in terms of our MHST. But again, this is where we have a specialist blend, and it's the early help and prevention element. And Melissa, who's joined us from Coventry and Warwickshire Mind, a big part of our delivery model was the integration with voluntary sector, and certainly our partnership with Mind has been a flavour all the way through our contract. And then the specialist multidisciplinary team. And this is where we see children and young people who often need a range of different interventions and approaches. So this may be a young person who needs to have support from a psychiatrist and a psychologist. So it's a range of different, but more intense work usually happens in that multidisciplinary team working. So just thought that'd be really helpful to share with you. I think it's also helpful to just have a timeline to know where investment started to come into children and young people's mental health, because it's quite hard to gauge how things have changed. So in 2014, that was the first time our government thought, you know what, there isn't enough investment in mental health for our children and young people. And what they did is they created a task force. That task force was tasked to look and see what investment, what interventions needed to happen. And as a result of that, in 2015, a document was produced called Future in Mind. That document is still as important today as it was in 2015. And it really was the foundation of starting to transform children and young people's mental health, but also to raise awareness with commissioners and those that work around a child that there is a need for further investment. And in particular, looking at some of the early help and prevention side of things. In 2015, following the Future in Mind, they came a 5-year forward view from NHS England. And what happened here is there were some local transformation plans, and this is where the first financial investment began. And each areas across the country were asked and tasked to have a 5-year plan aligned to NHS England that would start to see the change in how we deliver mental health care. Locally in 2017, following a tender process for Warwickshire, the RISE service was born, and this was a really important contract. It was the first ever outcomes-based contract. So in particular, the significant work we did with Young Minds was about hearing what was important to the young people. And we moved away from contractual time, clock start, clock stopped, and added more of that qualitative, so how did it feel? What was the experience? Did you feel helped? And that's been a real change, and it has influenced other parts of the country. That contract has been going since then. The next time of investment we really saw was in 2019, and this is when Jeremy Hunt was in power at that time in terms of the Health Secretary. We started to see some real shaping of early help specific investment, and the two trailblazers that came from that time was the mental health in schools programme, but also starting to have a look at an access and waiting time for core services. So the 4-week wait programme was also born. We were one of 12 pilot sites, and that was a really helpful. We helped shape some of the guidance that's currently out today, and we're still continuing to work with NHS England to look at how that gets translated into everyday practice. So as you can see, the last 9 years has been the first time of real investment in CYP mental health, and we're not finished yet. So I think it's just really helpful to understand how the vision we created still very much is held as the investment keeps going. Thanks, Ellie. Next slide. Okay, so this is our RISE umbrella, and we're very fortunate that we were named by young people. Really proud of that. RISE we're quite often asked, what does RISE mean? RISE has no acronym behind it. We went out in the first year of the tender, and this is what young people felt would be an appropriate and suitable name for how they felt our service should deliver. So they created the logo, and so we're still very proud of that today. So underneath the RISE umbrella of services, we have a number of areas that we deliver, and you can see all these around the RISE sun, and we're going to talk you through all of these as we work through the next bit of our presentation. But as you can see, that RISE umbrella is quite significant in terms of its reach, and there is significant areas where particularly say the early help and the MHST has seen more development than other parts over the last few years. Thanks, Ellie. So this is how we are currently delivering, and this shows part of the investment. So we have 4 main areas of our RISE umbrella for mental health. So in the first umbrella, there is the RISE Early Help. So we see here mental health in schools programme and our primary mental health team. Within our primary mental health team, we also have our Coventry and Warwickshire Mind colleagues and other voluntary sector support that helps enable that cog of our wheel to be developed and delivered. It's a really important part of our RISE umbrella of services. We also then have the RISE front door and our urgent care. So sit within here, we've got our crisis team, which we'll talk a little bit more about, but the navigation hub, a really important cog in the RISE umbrella, and that's where you'll find a lot of the activity when referrals are made to our service. We have clinicians and specialist admin who help to triage those referrals. They will speak with a various number of young people, parents, carers, referrers, and that might be schools or GPs, to make sure that they establish the detail that they need in that referral to help support the next part of the journey for that young person. So again, a really important part of our model. We also have the Think Family Outreach team. We're very proud of the Think Family Outreach team. They were developed during the COVID pandemic, and they were there as a response to the significant increase of young people who were presenting in crisis. This was something that was done, say, on a short-term measure, but actually the impact of the Think Family Outreach team has been so significant that our commissioning colleagues and also our NHS England colleagues have continued to fund the Think Family Outreach team. So we're very proud that the service that started as a COVID response has been able to continue, and it is now reaching more than the crisis umbrella. So a really important part of our front door and urgent care. We then have our core specialist teams, and this is where we see our biggest number of young people accessing support. So we have the access and engagement team. Really important part. They do, as it says, they're there to ensure access to the service, and they engage with young people to enable them to start to talk about their needs, to understand what the formulations are, work with parents and carers, so able to work through a plan of care for those young people. Our intervention hub, really important part. They hold young people while waiting. What we wanted to very clearly do in our RISE umbrella of services is make sure that no matter where a young person and their family are in the RISE services, their journey, that they're felt held and have a place to go at any point. So the intervention hub is a big part of that. And then we have our core teams, and these are the specialist teams. So we have our Coventry team, and then we have a North Warwickshire and a South Warwickshire, but they all very much are very connected and work together. And some of the specialities, such as psychology is a good example, and CBT, work cross cover. So that consistency and the evidence-based care is very much blended all the way through. We then have our specialist with additional vulnerabilities, a part of our RISE umbrella. And this is where you'll find those needs of young people that have, let's say, the additional vulnerabilities, family therapy, youth justice, eating disorders, and children looked after, to name a few. And quite often what we see in these areas is there is an increased need of multidisciplinary working, or the ability to support families requires that wider external partnership. So again, that's a big part of our RISE umbrella of services. Thanks, Ellie. Next slide. So just thought it would be helpful to just share with you some of the national picture and how children and young people's mental health, particularly following the last couple of years as COVID, is being described. Thanks, Ellie. So as we can see, and this was a report that was completed by NHS Digital, and I know the links are embedded into the slides in today's webinar. It's been really helpful if you have time to click on and read in a little bit more detail. But some of the highlights that was raised by NHS Digital when they did their survey in 2021, so this towards the end, was that 1 in 6 school children have a mental health difficulty, and I think that's really a starking, fact to read for all of us. A lot of things that we heard from that survey is that the need is increasing, that poverty is impacting, and that for us is very much, it was only on the news this morning, the 17.1% increase in your food basket. So without a doubt, that is a stress within the family unit, which will have an impact on our children and young people. Emphasis on child and young person centred approach, again, very much about placing the young person at the heart. Also in this report, it talked about the negative experience of social media. And obviously a big impact in COVID was all of a sudden our children and young people became very isolated and social media became very large. So again, that's an element that was covered in this report, so really helpful to read. Educational experiences, and this isn't referring to how schools deliver, this is referring to how children feel their experience is. And again, COVID pandemic flavour through this report, it was disrupted for every child and young person, and their ability to enjoy and understand learning in the way that pre-COVID has significantly changed. As a result of all these, we've seen risk increasing. The complexity of our children and young people's needs has also increased, and so has the vulnerabilities. And we've seen this in the RISE mental health umbrella, and Eve has obviously been leading on a big piece of work to look at that support and recovery that's needed for our children and young people. And one of the things we've looked at with our clinicians is where we would normally do a piece of work with a young person and say it was an anxiety presenting need, we were unable to support the recovery as we would have done before, because part of that recovery would have been supporting a young person to access their local community, to attend social events, to go to the local pictures, all those things which were taken away from all of us during the COVID pandemic. So as a result of that, we know we've seen longer recovery in terms of our children and young people, but also those young people that have been able to access that normal behaviour due to COVID, we're seeing that vulnerability in their needs. So just in the corner of this slide is a snapshot of our referral specifically to RISE mental health. And we've compared the post-pandemic to how it was at the end of 2022 in the summer. And as you can see, I mean, 2020 was an area when everybody saw a decrease in young person's mental health services. If you remember that the message we were given was stay home, and we naturally saw a decrease. But as you can see, from 2019 to 2021 and into 2022, the referral rate has exceeded the pre-pandemic numbers. And that's a really important change. And that's a change that we're working with the system around the child and young person, our commissioner colleagues and also NHS England to understand what the responsiveness needs to be from children and people's mental health. And again, this is a number of points that are raised in that report. So I just think it's really helpful sometimes to compare the national and the local picture. So hopefully that's helpful for you all. Thank you, Ellie. Next slide. So all the things that are found in the Centre for Mental Health is what we're seeing is in terms of increasing need. 1 in 4 teenagers are presenting with a mental health difficulty, and this is an increase from 1 in 6. The role of poverty, as I've mentioned just previously, strong link to young people's mental health. Patterns according to gender, and this is really important, and we do collate a number of demographic data to support our responsiveness as a service. But as we can see, in between the ages of 7 and 11, we're seeing more boys present with mental health difficulties than girls. But then as girls get older, that changes. And actually, there are a higher proportion of young women who present with mental health difficulties than young men. Now, well, what I will say is the caveat is they are people and young people that have presented. And what we do know is sometimes boys, as they get older and they start to go through their adolescent ages, quite often will be less emotionally they're feeling, whereas women do the opposite way. So this is a really important part for us to think about in mental health. How do we then work with young people, knowing that they're the facts that are presented with us in terms of key findings from national reports? In terms of the impact of social media, in particular, this report looked at young people with mental health difficulties. For those young people who identified themselves as having a mental health difficulty, they felt less safe online. This is a really important fact for us as the adults around the child to understand what we need to do to enable that to feel different. And also those young people who spoke in this report about having a mental health need also found that they had a higher increase of bullying online. And again, this is a really important part of that negative impact of social media and how we need to think slightly differently around that. In terms of educational experiences of children and young people, and we've seen this both locally and nationally, those young people with a mental health difficulty will miss more days of school. And this was just a snapshot that was completed in that report. And they're also less likely to feel safe at school. And part of this is they don't feel that they are able to enjoy their learning, to feel relaxed, to have a supportive kind of experience and time. And again, these are all things that are really important in our mental health in schools programme and a part of the investment that we're starting to see come through. So again, just kind of sharing the national and how it's very much part of our local picture. Thank you, Ellie. Next slide. So how do we in RISE support children, young people and the adults around them? So just to talk you through now in a bit more detail, our umbrella of services that we have. Thanks, Ellie. So I really help offer. So mental health in schools team. So this team began, the service began in 2019. We were very fortunate, say, to be the first pilot wave. And that was a really important turning point for children and people's mental health, because it was the first time where a programme is co-delivered with education and commissioners. So we have a really important triangle in this terms of the mental health in schools team. Each school that we work with has a mental health lead, and there is a dedicated training programme for that person within the school. The mental health in schools programme is an evidence-based programme. We have educational mental health practitioners, specialist mental health practitioners, youth workers, clinical leads, and an operational management structure. And what we do is we work alongside the university that help train up these clinicians, and we deliver a tailored approach in schools that looks at the CBT framework. But it also works with the whole school, and that's the bit that's really important when we just talked about the figures beforehand, is how do we change a culture in a school and how do we increase the awareness of mental health so that young people who are struggling with their emotional well-being are able to feel both supported and helped, and be that kind of wraparound is there for those young people. So again, a really important change in how we deliver our services. And certainly the outcomes that we want for the MHST programme is increasing awareness, creating a calmness about mental health needs, building emotional awareness, mood boosting, and also looking at some of those other things that we know make a significant difference to emotional well-being, and sleep hygiene, habits in terms of how you engage in activity, physical health, all of those things that make a significant difference are really important in that mental health in schools programme. We're currently just in the 5th year of the 5-wave programme. So nationally, the aim of the mental health in schools programme is that there is 47% of coverage for schools across a catchment area. So say we're just working towards that. In terms of our Warwickshire, South Warwickshire, Nuneaton and Bedworth, North Warwickshire and Rugby all have our MHST programmes delivering within their areas. And it is making a difference in terms of young people being able to access early intervention support at an early time, to go back to that vision of right time, right place for our young people. Thank you, Ellie. Next slide. So primary mental health team, a big part of our early help cog. They provide advice, support and guidance to the adults in the child and young person's life. Anybody who may have accessed the primary mental health team for a consultation, what they try and do is encourage the adults around the child to think about the young person's needs and put that wrap around. They certainly use the Dimensions tool as a really positive way of being non-jargon. Let's understand the needs. And they also help support some of that wraparound in terms of training and workshops and sessions. So there are a number of activities that they do over the term time with schools where they support the skill up of mental health awareness. And in particular, they work with the Recovery Academy also for some of that older age population. So really good complete offer in terms of helping that wraparound. Thanks, Ellie. Next slide. Just moving on to our core specialist teams. The multidisciplinary approach where we quite often see those young people who need a moderate to severe requirement of mental health. And I say these are a lot of the statements in the box here that's on the slide, where we know our young people have told us that they feel sad, they don't want to be here anymore, their difficulties with their family, their friends, their school. Really heartbreaking to hear how they want to either hurt themselves or are hurting themselves, being anxious and scared, problems with eating and food intake. And that's not necessarily in terms of an eating disorder, but what we do know is eating can be a part of a young person struggling to maintain control, and it can be used in lots of ways, both under and overeating. Having trouble talking or sleeping, hearing things, seeing things, the anxiety overload becomes very large for those young people, and it quite often gets manifested in those sort of kind of feelings and interpretations. Feeling angry and struggling to be in control, again, very anxiety provoking. And although we quite often see the output is the difficulty in terms of behaviour, or a young person, they describe this word themselves, I have a temper, I can't control myself. What's underneath that is the anxiety, and it's really important when we work with a multidisciplinary approach to get into that, that driver of the behaviour rather than just trying to treat the behaviour itself. Certainly concentration, all of us will be able to reflect on that. At times when we found things very overloading, we'll put the milk in the cupboard and the tea in the fridge. But for children and young people, not being able to concentrate, losing their friendships as a result is a significant part of disruption in their emotional well-being and growth. So again, a big part of sometimes what we see in terms of specialist mental health. We then have some different presentations where we might see the anxiety has increased to having an OCD element, such as the need to check or repeat things. And quite often this comes from that driven anxiety and control. And also, very sadly, that feeling that they have a very low self-esteem and confidence, and they actually don't like themselves very much. And we do a big piece of work to enable young people to feel that they are able to look at themselves and say, actually, this is what I am and this is who I am, and I'm very proud of that. So a big part of what we do. And in that core specialist teams, you'll find a number of evidence-based interventions and co-working with different parts of the multidisciplinary team. So again, every young person's journey is unique, and we want to be able to ensure that plan of care is wrapped around them. Thanks, Ellie. So our crisis and home treatment team, We were commissioned to deliver a crisis and home treatment team in October 2019, which, although for us it seems a long time ago now because the impact of COVID, it actually wasn't that long ago. And for our crisis team, they've seen quite a significant impact in terms of the COVID pandemic. Very new when we went into COVID, they were only just established by 5 months. But what we want the crisis and home treatment to still very much be is a team that is able to support immediate and significant risk, able to help others with their mental health. Where we find that a young person is at risk of admission, and that may be both an inpatient unit for mental health, but also we do a big piece of work with our paediatric colleagues. So McGregor Ward at Warwick Hospital, and obviously Ward 14 and Ward 16 at UHCW for our North Warwickshire young people. The crisis team are there when there's a risk of immediate harm, and that's really important. What we have been able to do is have a 24/7 offer for children and young people. Really important change in how we've delivered our services over COVID. And also what we want as part of our crisis and home treatment offer is a crisis resolution. So when a young person's in acute psychological or emotional distress and it's completely disrupting their functioning, there is the offer to support young people in a crisis resolution way. But what we have seen, particularly over COVID, is a significant increase in referrals, particularly to our paediatric wards. So it has been an area where we are working with further investment and transformation. So it's a really solid foundation what we're moving forward. Thanks, Ellie. So our Children and Young People's Community and Eating Disorder team, we have a team that has been growing through the pandemic, which is great because what we have seen is the rise for referrals, particularly for children and young people presenting with an eating disorder, both locally and nationally, has rocketed over COVID. The national figures, the last time they were reported was an increase of 66% in referrals. And obviously that was something none of us would have anticipated with the COVID pandemic's impact. But what our Children and Young People's Community Eating Disorder team do is they work in collaboration with children and people and their families. We offer specialist assessment and treatment provisions. We want to very much restore both the physical and the psychological well-being. You can't do either without the other, and that's really important. So although at some parts of a young person's journey within the eating disorder team, the priority may be on the physical health, because that's really important, increasing weight, ensuring that a young person has the right nutrients to enable their cognitive ability to function. It has to work hand in hand. So really important that the community eating disorder does both. We work in particular with young people who present with anorexia nervosa, bulimia or binge eating. We also offer very much the NICE guidance. And although there's some new guidance, it's currently being worked on and is due out in the spring, April 2023, that in terms of the guidance and making sure that the CBT offer is evidence-based, it's not anticipated that will change significantly. But we do offer support from a cognitive behavioural therapy point of view, particularly it's a particular route for eating disorders, dietetic support linked to mental health, nutritional need, medical monitoring, and of course there is a whole package of parent carer support, psychoeducation and evidence-based group. And where there is a need for a young person to be admitted to a Tier 4 unit, a mental health eating disorder inpatient unit, we support that risk and we make sure that there's consistency of care. Thank you, Ellie. So this is just a screenshot of our website. It's currently, and Eve will be able to answer a few questions if there is any about the website. It's currently being reviewed and updated. It very much took over the COVID pandemic, had to be led to support the COVID, and that was both a local and a national direction for us. But what we just wanted to share was that there are resources for parents and carers, as there are for professionals and children and young people. And you can see on that screenshot, the link there is for the number of courses that our primary mental health team do, some of the leaflets that are important, and some of the contacts in terms of where you can get support. And if you're on that page and you scroll down, the Dimensions link is there as well. Although the Dimensions link is in lots of different parts of the RISE website, it is there as well. And it's a really important tool to enable us to support and understand your needs and the child and young person's needs. Next slide. Thank you, Ellie. So just some of our transformation priorities for the coming 2 years. So this is the NHS long-term plan. Everybody has an expectation that they will deliver something differently by 2024. And these are our key priorities that the NHS England has asked us to deliver on. Eating disorder is really important. So I've just talked a little bit about what the current offer, but what we are doing is we are expanding the core specialist eating disorder service. We are in the process of developing a home treatment intervention as part of that core offer. So this will help a number of young people where we know they are on the cusp of needing an admission to hospital and offering some of that really valuable support in the home with the families, particularly around meal times when there's difficulty in a young person being able to respond and support the feeding and enabling them to psychologically transfer what they do in their sessions into their home environment. So again, that's just starting to roll out now. Expansion of eating disorders for 18 to 19-year-olds. Again, this is part of NHS England's directorate because what they see is that's a really important age. And that doesn't mean that post-19 there isn't a need for eating disorder services, but in particular thinking about that young person model. And RFID is a big part that we've been working with. And our Commissioner Helen Broughton, who I believe is on the call today, we've been leading in the system a conversation about what an RFID offer can look like for children and young people. And we really are just at the start of this conversation. I'm just really important to stress that the NHS England also are at the start of this offer. And although there's some really positive practice examples, particularly in the Maudsley, where obviously we see a lot of investment in mental health and Great Ormond Street, for other parts of the systems, we're at the very beginning. So again, we're trying to do a really important piece of work with the system. So our paediatric colleagues, our acute colleagues, our community dietitians, neurodevelopmental colleagues, in terms of what would that look like. We're at the very beginning of that story. In terms of our crisis, again, this is a big part of the long-term plan. There is an expectation that everything will be 24/7 by 23/24, that the expansion of the crisis service will have both a hospital and a community offer. We currently do have both, but we obviously always looking to extend that and support that. And part of what we've done within our crisis offer is we've increased our cognitive behavioural therapy workforce. And the reason we've done this is because what we know is the number of young people who present in crisis, often the core reason is anxiety and low mood. And cognitive behavioural therapy is one of the most successful approaches to doing that. It doesn't do it all, but the intelligence we have from our patient data and our patient flow tells us that that is a big part. So our aim is, if we start to support that quicker, then we should see less young people presenting in crisis for that particular need. Digital and early help. I've talked an awful lot about early help, so I think that shows, we're just finishing wave 7, we're now on wave 9. In terms of digital, what we are doing is we're working on an e-portal, and this will significantly increase the access and referrals. And our RISE front door, which is our navigation hub, and our crisis team are all part of that. So they're our long-term plans from NHS England. Next slide, thanks, Ellie. In terms of what we are also doing in RISE, because there's more to our transformation than the direction from NHS England, the intervention hub is a really important part in terms of a dedicated clinical and patient flow expertise team. Our access and engagement team, which again we started to do in COVID, and it's been so successful that we are continuing to roll this out. And they are a dedicated team that are doing just that. They're at the beginning of the young person's face-to-face journey, and they're there to support and enable that journey to be on a solid platform and have a plan of care. We've worked towards achieving CORC accreditation. This is a really important part of mental health for children and young people. So Child Outcome Research Consortium is what CORC stands for, but fundamentally underneath that acronym, it's about routine outcome measures and making sure our children and young people have their say in every session, that parents do as well. But also for us, in terms of our evidence-based care, we're demonstrating the impact and we're supporting both the individual child and young person, the service and the system. And it has 3 strong pillars in that. And it really does help us to be responsive in terms of how we deliver at all different levels. We have been one of the lead providers in terms of a multi-agency dashboard, and this has been really important over the last particularly 2 years, where the Children in Crisis work stream. And again, it's led the system. And when I use the word system, I describe the commissioning system, the acute system in terms of our paediatric colleagues, NHS England, in terms of what that crisis needs to be. And it has enabled significant conversations from this intelligence. Our primary mental health team are currently expanding into GPs, and we are working on a pilot with Rugby to roll out something called RISE roles, which, apologies, it's not my acronym. It's a role, additional roles reimbursement scheme is what it stands for. It's an NHS England strategy, and it doesn't just apply to mental health, it applies to physiotherapy, occupational therapy. So you may find yourself in your own GP practices that you've got an easier access to a physiotherapist, for example. It's based on that principles. So the CYP mental health is the final bit of that RISE rollout. So we're just starting to roll out in Rugby, and that's a 1-year pilot. And then youth workers and co-production, really important thing in terms of our development. And we recognise that this is part of the RISE umbrella that we need to strengthen. And so a big piece of work we've been doing is working with LifeSpace to enable us to do that. Thank you, Ellie. Next slide. So just a new list of some new developments that are able to for you to see how we're working more with our voluntary sector. First Steps is an organisation that we're working specifically with eating disorders. LifeSpace, our particular part of our youth workers rollout. The dimensions really important. We're obviously doing a big piece of work with in the written statement of action, leading the way through crisis care, and of course, I Want Great Care, which people will fondly remember family and friends testing. It's replaced that with far more depth and I statements, which are really important for children and young people. And then I think that's my final slide, Ellie. Thank you very much.
Thank you, guys. That's lots of information, lots of things to process, and we've got some questions for you. Just to explain again, for those people listening later on the recording, the questions and answers from this session will be compiled into one document and will be available within the local offer and next to where this recording is saved. So hopefully you're able to access those. Thank you very much.